this the same legislator? We did all three of these already?
No,
Same
this is,
legislative request, number 180.
this is a different one. This is a senior medical billing clerk versus a medical billing clerk.
And you put them all on the same legislative request?
I did.
Okay, that's fine. So legislative request number 180. Do I have a motion?
So move, Lujan.
Second, Tui.
Thank you. Go ahead.
This is similar to the prior positions. It's based on a study. We've decided to create a senior medical billing clerk, grade 11. That will be, and then we will defund the principal account clerk, grade 8.
Right. And how long has that person been in that position?
Approximately 5 or 6 years.
Okay. Any questions from committee members?
Chairman,
Go ahead. Keith.
Tui. Donna, when you're the senior medical billing clerk, and are you going to be, when you say reclassifying, you're just reclassifying the principal account clerk to the senior medical clerk?
That is
Correct.
correct. That
Okay.
is correct.
Thanks.
You're welcome.
Does everybody have the memo that should have been attached? If you look at the memo, it has the old position and the new position, and then the difference in the pay scale. That might help if you're looking at that document.
Everybody see that?
Mhm.
So I see the numbers for the previous 6 that we did that increased 24,000, Lawrence. I don't see the numbers for this one.
Well, I said 6. They're all 6 positions are, if you look at these requests, it's a total of
24.
6 positions. 1, 2, 3. There's 3 in the first B1, 1 in B2, 1 in B3. That's 5, and then C is on its own. It's a separate position. So that's 6 positions total, and they're all spelled out on the second page of the memo, along with all.
Yeah, I got it. So for this one, how much were they making now? They were hourly.
This one
rate
is- we're on this-
$23.59. The senior account clerk, or are we the one above that?
We're on the senior medical billing clerk, so that would be the second position on the list. So it's going from 26.60.77 an hour to 28.07.87 an hour, for a difference of $2,868 and change a year.
Okay. Everybody see that? Any questions?
I have a question, Mr.
Go ahead.
Chairman. Just, you melded the amount from that position into this one as well?
Yeah,
That's in
that's
the budget? So again, I want to ask you, so you defund the principal account clerk, but use that money to supplement this new position, right? And then are you doing away with the principal account clerk position? Or are you gonna
Yes.
look to fill that as well?
Yes, no,
No.
we can't do away with it until you approve this.
Right, I understand that, but even though you're defunding it, it's still a position if we don't take it off the books. If you're reclassifying a position and it's a new name, it's a higher title, that position stays on the books unless we eliminate it. You're defunding it, not eliminating it.
It's almost like a swap, Mike. So we're swapping one position for the other, and then the vacant position will be defunded.
Yeah, I understand that part, but that still leaves that position on the books. Debbie, could you clear that up for us? If you're on.
Right, Deb, I was just gonna say the same thing, Michael. Deb,
So yes, it is on the books, but it would become a vacant position and it would be unfunded. Because they're gonna use the funds for that position to fund the new position. And I believe in the
And
budget for
they-
next year, they have classified it as the newer positions, Donna, is that correct?
Yeah, Tammy, I think worked with Gretchen and we added the money.
Yes. Yes, so while it's not being abolished, it is defunded.
and they would have to
Okay,
come
so they'll
back
have
to
an
us.
opportunity to fill it if they need to.
Only if they come to
No,
us.
we won't. No, we're not gonna fill the old position. We're swapping a position one for one, Mike.
Yes, Lawrence, I
Lawrence,
understand that. I'm
this
just
is-
saying, if the position is still on the book, you'll be able to fill it if you come back to us. That's the question. I
Not if
get
it's
it. No big
unfunded.
deal. We can move on.
Not if it's unfunded, we can't.
All right, so let me finish this, debate, all right? So if it's still on the books, all right, you can actually get the position. All you have to do is come to us because it's not funded, all right? That's his point, and it's a valid point, all right? So it's not abolishing the position, which we debate about this every budget. If you're throwing, you know, 1 grade, 2 grade, and in some cases, this is 3 grade promotions, you're not abolishing the positions. So I think we'll have to have a meeting in both caucuses, all 3 caucuses about this going forward, because we eliminate it. All right, so let's eliminate them. All right, so that's an argument for next year, Michael, all right? So, but
Yeah,
it's
thank
very valid that we go through this every year with all these upgrades, all right? All right,
Got it.
Got it.
yeah. Okay, all in favor?
Aye.
Aye.
Aye. Opposed? Carried.
Mr. Chairman, Michael Amo, I'm sorry I'm late. I got caught in
I
traffic.
see you, I saw you there, so welcome.
Thank you. I voted yes on that. Good.
Okay. Doreen, you have that?
I do. Hello, Michael.
Lita
Hello.
Amos with us. So, B3 is a request to create one prescription insurance clerk, grade 9. This position is for the reclassification of one principal clerk, grade 7. Legislative request number 180. Do I have a motion?
So moved, Total.
Second, Luhan.
Okay, thank you. Go ahead.
The person in this position as a principal clerk is responsible for all of the Medicare D plans for the population we serve. This position has evolved over time, regulatory requirements, benchmark plans, annual enrollments, and as a result of the recommendations of county HR, we will replace the principal clerk with the prescription insurance clerk, grade 9.
Any questions on defunding or vacancies or the ability to fill this position? Okay, so.
I
Jimmy,
have a
I think it's the-
question.
Jimmy,
Same
Tammy,
exact
Just a question.
scenario.
I-
Go ahead, Mike.
Yeah, thanks. I won't ask the question. I get it. But my question is this principal clerk, grade 7, is she the prescription insurance clerk now?
yes.
She will be when
She
you
will
after
be when
this is
you
approved.
approve it.
Yes, yes.
No, I heard you, Lawrence, but my question was, does she do prescriptions now? Or he, or whoever?
Yes, she's doing that work now, yeah.
Yes, yes.
All
Yeah.
right, thank you.
Any other questions? Hearing none, all in favor?
Aye.
Aye.
Opposed? Carried. 1C is a request to reallocate reimbursement an analyst from grade 16 to grade 17, legislative request number 181. Do I have a motion?
Tortel.
Second, Tui.
Thank you. Go ahead.
Hi, this position is a lead person in the finance department. This position has not been reviewed since 1989. A lot has evolved from accounting standards, regulatory requirements, billing, budget responsibilities. And as a result, we're seeking to reallocate from a grade 16 to a grade 17.
Any questions?
Chairman,
Go ahead, Pete.
just was wondering how long, is that the same person moving up and how long have they been with Valley View?
I believe that this person has been with Valley View for 25 plus years, maybe 30. Tammy, are you on the line?
Yes, I've been here 26 years.
God bless you.
Yes,
That's what I was.
well
gonna say.
deserved. Thank you.
Okay.
Yeah.
All in favor?
Aye.
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 Opposed? Carried. We go to your monthly financials now.
The results that we're looking at are as of September 2021. That represents the end of the third quarter for the facility. There's been no change to IGT funding since the last publication. Other revenues, public nursing home revenues are coming in at $28,281,000. Personal services, we're coming in at $15,806,000. We've purchased equipment totaling $75,000. On the contractual side, we have earmarked for expenditure $3.2 million, and we've expensed $7.3 million. Employee benefits are coming in at $12.4 million, and we have a small amount of serial bond debt of $103,000.
Any questions, Legislator Tortel?
Thank you, Mr. Chairman. Donna, have we had any communication on the IGT funding?
Yes, we
I know that a
have.
lot of times it comes at the fourth quarter and the end of the fourth quarter and sometimes into the previous year.
Right. We are still, the information that we have from Leading Age is that we are still on schedule to get the payments that we normally do. The wild card is how much those payments will be.
But we've
Okay,
had,
we had budgeted 8 million. Do you anticipate that we'll get close to that?
I am very hopeful, yes. It's all tied to the Medicare upper payment limit, so it will depend on what they decide.
Okay, and then the census right now, what's today's census?
Today's census is
70, just over 75%.
Okay, and then, Mr. Chairman, would it be appropriate now or wait till we get into the monthly update in regards to the question that you and I were discussing last Friday?
No, you can do it now. That's the monthly update. We're not gonna get an all report. We're just gonna do questions on it. So go ahead.
Okay, last week I was at a local town board meeting and I had a couple of people come up to me who have family members that are residents of Valley View. When they came up to me, they were told that they received an email from Mr. Ledoux regarding COVID positive patients. I know you have procedures and protocols. I would just like some reassurance. And once again, I mean, we've constantly asked this of this committee since the pandemic started. When you send communications to the family members to let us know also, because I was kind of blindsided by this and I didn't appreciate being blindsided that they have an email and we've repeatedly asked for these emails to be, especially to this committee and to our chairman. So I reached out to our chairman and I asked him if he received any communication, just hadn't had a chance to forward it. And he was surprised. He did not receive any communication. So my understanding at that point last week on Friday, in speaking with the deputy county executive, was that there were 10 positive staff, and I'm not sure how many positive patients. I was told by the family members that those patients were being held in their current rooms. And I was under the impression, I know this is a multi-part question, I was under the impression that if you had positive patients there, residents, they would be moved into one of the unused wards for isolation. Can you please give us an update on this and these questions? Thank you.
Sure. I'm sorry, I didn't inform you of the first set of positive cases. I did. You were updated on Friday with this of the most recent positives, and then again, I sent you a communication today of additional positives. So when a staff member or a resident tests positive, we have to notify the family members per the New York State Department of Health regulation, and I do that regularly. As I said, I apologize. I missed sending you one notification regarding that. So currently, we have 6 residents that are positive, and they do not stay on their unit. We have a unit, one of our short-term rehab units. We have a plastic curtain that is set down in the hallway that designates past that plastic curtain is the COVID positive area. And as soon as a resident test positive, they are moved off of their unit to that area. So that's where they are.
Okay, and how many staff do you currently have out as of today? I didn't get a chance to see today's email.
So I think we have 6 out currently. 10 of them, a bunch of them returned over the weekend.
Can you verify whether any of these COVID positive cases were people who were vaccinated or unvaccinated?
I believe all of them were vaccinated. Some of them were not completely vaccinated. In other words, they may have had 1 dose of the vaccine.
Thank you, Lawrence. Thank you, Mr. Chairman.
Okay. Any other questions on the finances? All right, go ahead, Donna.
And 2 right now, we do have 2 units that are closed, and as you all know, we're working through a bit of a staffing issues. And that's all I have on the finances for September.
Okay. Any questions on the finances? All right, thanks for the update.
Welcome.
Everybody was sent a copy of the written report, so if you have any questions, you can ask them now, or you can call Lawrence tomorrow or the next day. All right, we'll move to item F, the budget review for 2022. Do I have a motion?
So moved, Tortel.
Second, Lujan.
Thank you. All right, the floor is yours, Commissioner.
Thank you. So some of the highlights of our 2022 budget, there's still no county taxation. We are anticipating a little over $1 million, $1.3 million decrease in revenue based on our Medicaid rate. So we have, let me see here. We have slightly reduced the budgeted IGT funding based on our historical average of funding that we have received. Personal services.
Here.
Hold on. Sorry. I got too many papers in front of
Go
me
to
here.
237.
So yeah, personal services were down slightly from the year before, just 0.21%. Equipment, we are down almost 35%. Contractual, we're down just under 2%. Interest on debt, we're down 17.5%. Employee benefits, we're down 5.62%. We did have to utilize appropriated surplus of 6.2 million to balance this budget. That'll come from our cash account. That's the high level highlights.
Questions?
I have a question.
Go ahead, Legislator Tui.
Thank you, Chairman. Just wondering where that cash balance is today.
I printed it this morning. It is 45 million as of today.
And do we still have money that's outstanding for the major work, the renovations?
Right, we started in 2018 was the year we started funding capital projects through our operations. So anything that is sitting out between 2018 and 2021 that we haven't expensed yet has not come out of that money, the 45 million. Also, any operating losses for the facility at the end of each year will come out of that pot of money, the 45 million.
Yeah, do you have an estimate of what is still outstanding?
I will have that for you in the next committee meeting.
Okay, thank you.
You're
Thank you,
welcome.
Chairman.
Just, if I may, Mr. Chairman, Legislator Tortel sent us a couple of questions and I'll address those.
Go ahead.
Page 241. She asked about the staff manager position. It's on page 241. It's the very first position on the top of the page. That increase is due to this person is due a step 9 increase in November, and then she'll get her contractual increase in January. So that is the reason for that increase. And we have removed one position from this 2022 budget, and it is the occupational therapy assistant position. Yes, so we are removing that one position.
All right, go to the next one.
You have another one?
That she had another question about the home health budget, but do you want to do that separately? We're just talking about
that.
Okay, so the home health budget.
Have a follow-up question, so answer her other question, please.
So the question on the home health was, we changed a position this year. I believe we did talk to you about this. We changed a position from a supervising account clerk, grade 10 position, and we created this new home health care clinical manager position. This is an RN position. We had previously spoken to you about needing two full-time RNs to man this operation for coverage. And that is why the increase is so significant.
For reference to everybody, that second question is on page 254 of the budget. It's line 563300, right above the bold personal services subtotal line. Thank you, Lawrence, for answering those questions. I appreciate it.
Yeah, of course.
All right. Legislator Minority Leader Paduk.
Yes, thank you, Mr. Chairman. On page 254, lines 571820 and 30, your consulting services, non-medical health and medical health. I see that in this year's budget, you were allotted $225,000 and you've only used 10. Is there a reason for that at the halfway point?
Donna, can I answer?
Yeah,
Yeah, go ahead,
I was gonna
Tammy.
ask you to.
The non-medical health, what that is, it's actually the cost report. So we've only paid a portion of the audit fees for the cost reports. Non-medical is our accountants. O'Connor and Davies.
Okay, so the medical health then, that's the one I just asking about, right? That's O'Connor Davies contract?
That's the
review?
non-medical.
And not, he was
He's
asking.
asking about the
None.
medical, the line below,
Yeah, I'm
Tammy.
asking the next line down.
The medical, we've only spent 10,000.
That's as of year to date, 6/30. That's what I was asking. You were
Let me look
allotted
at that.
225,000 and you've asked for that in the 2022 budget. I'm wondering if you're gonna meet that or you don't really need that much.
Oh, I know, I can answer that question. That was for, this is all the expenses for our rehab, our dietitian, home health aides, social workers. We didn't start this program until March, so that's why it's significantly under. And there will be more
So you have
expenses. There will
You
be
have
more
about a year to
expenses.
date now?
There will be more expenses year to date, but that's why the number was so low. You gotta remember, we did this budget back in, when did we do the budget?
May of 20.
We did the budget in May, and the child was only open for a couple of months by then.
Right, okay. I'm okay with that. I do have some other questions and I really hope you have a good, can we do home health now, Mr. Chairman? Or are you gonna stay with the first part of the budget review? Valley View is over. I can do Valley View home health?
You can go home health, go ahead.
Okay. I just have a couple of questions and it bothers me in every department. So maybe you can explain why. On your contractual expenses, over the last 4 years, 18, you were allotted 247,000. You didn't use any. In 19, it was 443,000. You used $9,000. In 20, you had 409,000. You used 31,652. My question is, are these contractual monies grants or are they county taxation?
Mike, can you just let us know what page and where you're looking at so we can all look at the same thing?
Everybody has this 4-year trend, which I've been referring to, that the county budget department prepared for us. It gives us a ton of information in how we can review their budgets. So these questions are based on 4-year trends at Valley View. So that's my question. I am concerned.
So Debbie's
concerned with
got
that?
an answer. Debbie's got an answer for that, so.
I do.
Okay.
So we started budgeting this position back in 2018. However, the program never really started operationally until March of this year. So that is why there was no expenditures.
Wait, Deb, I'm talking about contractual expenses.
Correct. Correct. For the home health program.
Okay, so why, I see that it started in 19, right? Modified budget in 19 had $443,000 in it, and they used 9,714.
Correct, but the program really didn't get started with patients until March of this year. So that's why there was no expenditures in those lines.
Okay, to March of this year.
Correct.
Correct.
So a lot of those previous years, Mike, are gonna look like that because we didn't start taking patients until March of this year. But we had to have a
Well, my
budget.
question-
We had to have a
I get it.
budget, obviously, if the program was up and running full speed.
But my question is this county taxation money?
There's
No.
no county taxation in our budget.
No, not
Okay,
for home health.
just wanted to
either.
make sure. Thank you so much. That's all I have.
Okay, Leader Amo, patiently waiting. Go ahead, Mike. You're muted.
There you go. How about now?
There you
Good?
go. Good.
Okay. This is to Lawrence, and it's just more of a clarification. You began your presentation by saying that Medicaid on the revenue was down 1,300%, minus 1,340. Is that what I got that right? No, 1,340. Was that a rate function? That's a million, excuse me. Was that a rate function or a decrease in actual revenue from Medicaid? And is that a trend? Is there any trend we should be concerned about here?
That's a great question, Mike. It's merely a part of our rate. As you guys know, our rate goes up and down based on our CMI, and it gets looked at 2 times a year, once in January, once in July. So we are getting paid on a cycle now where unfortunately our rate had dipped. So, you know, we have less Medicaid revenue as a result of that. But it has gone back up since, right? Have we gotten the?
Yeah, it has. The other thing is that when we grow our case mix, it was being constrained at 5%. So even though we grew it, they were withholding money. So there's a new methodology now, and now case mix is a blend of 6 months. So, and they have removed the 5% cap. So we're hopeful already. I think our rate has bumped up maybe like $7 or $8 a day. So we'll have to see what happens in the next CMI period. This is a brand new methodology.
So it didn't have anything to do with any clinical review that affected your rate. This was a methodological issue. Is that what you're saying?
Correct, and a byproduct of case mix. CMI.
Okay, yeah, I knew that. I knew they do them twice a year. I got that. Yeah. Okay, I just didn't know if it was something, because that's a good bite, and we wouldn't want to be going that way if 70% of our population is Medicaid and we're seeing a reduction in the rate. We should be keeping an eye on that.
No, you bring up a great question,
Yes,
Mike. That's a great point.
Very good point.
Thank you, Mr. Chairman.
You're welcome. Minority Leader Paduk, you have another question or you?
I do, Mr. Chairman. Thanks.
Go
I should have
ahead.
asked it before.
Go ahead.
When you talked about your appropriated surplus of $6 million to balance your budget, is that money that you gave to the county so we could in total to help balance our budget? And is that part of the $9 million we used to balance our budget this year?
When we do the budget, the difference between our revenues and expenses results in what we ask for in appropriated surplus. That is the money we needed to balance our budget. That money does not actually hit our books, our cash account, until the end of the year and the audit is done and they see what the final financial outcomes is for the facility.
Okay, so my question was really, did the county executive take money from your fund balance to help balance our budget? And if he did, what was the amount?
Okay.
No.
Yeah.
He did not.
Okay, thank you.
Mr. Chairman, Mike Anagnostakis.
Go ahead, Mike.
Just clarification on, I think, what Mr. Paduk is asking. Donna and Lawrence, you got a great budget, but people have to remember this is kind of different in other departments. This is kind of like a business, and it's a moving target. We don't know the revenues that are going to come in, multiple factors, the census, the CMI. Your budget requested $4.628 million of surplus to balance your budget. The executive then took out an additional $1.666 million for the chargebacks. And that's why your surplus that you're appropriating is $6.294 million. So to answer Mr. Paduk's question, out of Valley View's budget is coming out of the surplus $1.666 million to go to the county. What the county does with it, I'm not sure, to further answer your question, Mr. Paduk. But Donna, you just want to verify everything I said, basically?
The 1.6 million is the charge for county services, yes. At year end,
it's actually $1,666,652.
Correct.
Correct.
Okay. Just want to make that clarification for you, Mike.
Yeah, thank you, Mr. Anagnostakis. You've been pretty good at that.
Legislator Tortel.
Yes, thank you, Mr. Chairman. It's one question that I forgot to ask before, and I apologize for that. I know that we've had staff at Valley View that were let go because of the vaccine mandate. They were terminated. Then they got vaccinated. Have they all been reinstated? And can you give me the figures on that, please?
I don't have them in front of me, but I think we've reinstated 1 or 2 employees that chose to get vaccinated. It hasn't been that many. We really didn't lose too many full-time people, but I can get that information and send it over to you guys.
Yes, I'd like to know how many were terminated because of not receiving the vaccination and how many have been reinstated, please. Thank you. Thank you, Mr. Chairman.
Yep.
You're welcome. Does anyone else have any questions on the budget?
Yeah, Mr. Chairman, Mike Anagnostakis.
Go ahead, Michael.
Thank you, Mr. Chairman. And I think the statements we're going to make on it basically were what I made to clarify Mr. Paduk's point. But again, no county taxation is coming out of here. You guys requested $7 million of IGT funding, and I did confirm with Social Services Commissioner that the MMIS line in their budget has the appropriate amount. Lawrence, quick question. I don't believe it's a 50% anymore. I believe the county is paying a little less than 50%. I read that somewhere, but I don't remember what the number was. Can you just clarify that for me?
Yeah, you're correct, Mike. Hang on one second. I think it's on that IGT.
Oh, is it here?
It is. You have that IGT.
here?
Yeah, you're right, Mike. Yeah, the federal match was decreased from 50% to 43.80.
Okay, so now we're paying 43.80% to get of that $7 million, correct?
Correct.
Okay, great. And let me ask another question here. You obviously, like I say, it's a moving target. You're estimating almost 51 million of revenues, including that 7 million of IGT. But those revenues are really going to be the CMI is going to be very important. Did you calculate this budget based on the lower? Did you make an assumption of the lowest CMI that you currently have when you did this budget?
Tammy?
The CMI, did you calculate the lower CMI that you currently have?
Yes, Donna, we budgeted at the 278, so it was the lower.
It was the lower.
So
Yes.
good. So any increase that we're seeing now, and hopefully additionals that you'll see in the next 6 months, will only increase our revenues amount. And the other question I had was on the revenues amount. What census did you project to come up with your revenue figures for the full average for next year?
Yeah, we used 90%.
You budgeted in for 90% average for next year?
We did, Mike. We were up to 81% last month, and we didn't have any, we thought we were going to be back to normal by January 1st, and then we've had staffing issues, and we had to close 2 units. So, since we put this budget out, so there's going to be another big hole, unfortunately, to fill next year.
Okay, 90 seems aggressive. I thought maybe it would have been a little lower, but like I say, it's a moving target. We'll see what happens. The only line item question I had, if I can go to page 245, the last line item, liability insurance. And again, I'm not looking to make a change here because whatever the revenues you come up with at the end of the year, there's no taxation. Even if we made a change, it's just that you would get less appropriate surplus that you would have to use if any of these line items were different. And so it doesn't make any sense to change them. But I'm just curious that last year, the actual year, we had 80,000 and change of liability insurance. This year, so far, half a year, we don't have any, but I get it. Maybe you pay it in the second half of the year. But why did we go from 81,000 roughly to projecting over 500,000 for liability insurance? Something happened there?
Tammy?
Hold on, let me see if I can.
Yeah, that is a charge that's given to us as a county charge. So when we prepare our budget, that's actually something that's given to us by budget. Then when we do go to pay it, which we did pay it in August, I believe, which is why you don't see it on there, then they reallocate it to the 5 different liability insurances: the property, the auto, the public officials, malpractice.
But did it get allocated last year in 2020 for a total of $80,688?
It would be the year to date. I'd have to look at the final expense for 2020.
Yes.
20.
Well, that's what's in the budget. That's what's in the budget book for 2020 year-end actual, $80,688.
I know I had to transfer money around. I would have to actually look at the charge that actually did happen in 2021. You're looking for the 21 charge?
I'm sorry. No, I'm talking about 2020 actual charge.
Looking at this number here, the 2020.
Yeah, the actual charge is what's on there. The the 2020 final is on there.
Okay, so I guess my point I'm making here is, it seems to me that it's, if you were coming in at 80,688, that 541 seems to be a big number. Not that it makes any difference. Like I say, if we reduce that number on that line item, we would just be reducing your appropriated surplus that you would be taking out of your own account, and you're going to take what you need regardless of what we do. But it just seems strange why you put in 541 when it was only 80,000.
Let me go to the insurances.
Does everyone follow what I'm saying?
Yeah, I see
Yeah,
where,
Yeah.
we see where you're at, Mike.
and what happens is every year, that's what ends up happening. The county in May gives me the charge projected for the next year. That's how I budget it. And then when they actually send me the current ID, then I usually have to reallocate the
Okay,
way the
all right,
prices-
fair enough. Fair enough, I get it. I'll keep it in my back pocket in case we're ever in a year where there's actual county taxation coming out. I'll keep this in my back pocket knowing that I could reduce this line item. Thanks, guys.
Thank you, Mike.
Thank you, Michael. Any other questions on the budget? All right, so hearing none, we're gonna vote on both the Valley View and the Valley View Home Health budget together. All in favor?
Aye.
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 Opposed?
Should we say something?
Carried. Thank you, Lawrence.
Jimmy, we have capital for them.
Okay,
Hold on.
we have 6 items on the capital. Do I have a motion?
So moved, Luhan.
Second Tortel.
All right, go ahead, Lawrence.
Hold on, Donna went to go get, our capital information. For some reason, we didn't have it with us. I apologize for that. Just give me a minute. You want to just? You have the total summary?
Yeah, there's a summary in there. 6 items, right?
All right, sewer plant upgrade is the first. So,
Yeah, so we have a total of, for 2022, looks like just over $4 million. Sewer plant upgrades, resident unit improvements, lifter safety, some of these things we do every year. The resident unit improvements, the lifter safe patient handling. This year we added window coverings and hardware, food service equipment we do annually. And then we have Towser Simon roof replacement for $3.6 million.
and that's gonna be done next year? The roof replacement?
We believe it's going to have to be. We're in the process of working on a 5-year plan, and that hopefully will give us a timeline as to when that'll need to be done.
Okay. Any questions on the capital plan?
Mr. Chairman,
Go ahead, Michael.
just on page 8, 101, the sewer plant upgrades. Do you have $135,000 isn't gonna do much in upgrades? I know it's available to you. Are you holding that just in case something happens, or is there a
Yes.
plan to upgrade something?
That's really just for fixes, Mike. If something breaks down, we need to replace a motor or something like that. That's all that's for. It's obviously not for, sewer plant, total replacement. It's just for upgrades. If something breaks, we have money there to fix it. That's all.
Yeah, I figured that. I was just concerned because on the Valley View Committee, I have a big concern there that we have no master plan and we're doing all these proposed sewer upgrades and we don't even know what we're putting there. We need to figure out the master plan, who's going, what's it gonna be, and how much sewer capacity we need to ensure that when we spend the money, we spend it right. That's all. Thank you, Lawrence.
Thank you. Any other questions on the capital plan as presented? Lee, go ahead. Legislator Benton?
Thank you, Mr. Chairman. I believe that the capital committee plan was amended to include $75,000 for a
Oh,
bus
thank you.
as well. So that's actually missing now from the plan, and I think should be added. We told the Valley View.
When was the bus
Guidance
added?
Council-
Bus?
What?
When was the bus added? Nobody.
Lawrence, I'll recognize you when Legislator Benton is finished.
It was added in the capital committee, which I sit on. And again, I'm only bringing this forward because if they come with a proposal that is acceptable, it was meant to be in the plan.
That's correct. That's my fault for not mentioning this earlier. We've had discussions on this, and even if we put it in the capital plan today, with the backup in ordering buses, it'll be a while before we get it. So I'm gonna make a proposal myself to amend the capital plan to include $75,000 for a new bus for Valley View.
You would need a second, Mr. Chairman?
Yes, we do need a second.
I will second it, Mr. Chairman.
Thank you, Legislator Lujan. Now, Lawrence, you can have your say during discussion.
You can put the bus on there. I don't anticipate moving on that bus. I don't think we need a bus, and I'm not in agreement. I just want to put that on the record, that's all.
That was noted in your notes, so noted. So, like I said, during the aging budget, they also discussed having a bus. So there's a need throughout the county for additional buses. Go ahead, Legislator Benton.
Yeah, I just wanted to tell Lawrence, I want to see the plan first. I mean, we told the family council we were going to put the bus in the capital plan, but of course, it has to have an acceptable plan for, who uses it, what it's going to cost to operate it, oversight, other attendees that are going to help the residents on the bus and wherever they go. So I'm not totally in favor of the whole plan necessarily, but I just wanted to make sure it was put in the capital plan like we told the family council. That's all.
Thank you. Debbie, go ahead.
I got it. I'll put the adjustment in.
Well, we didn't approve it yet. We just got.
Okay.
All right. All in
After you
favor?
vote.
All in favor? Aye.
Aye.
Opposed?
Aye.
Carried. Now you can put it in.
I'll put it in.
All right. Thanks for doing that, Lee. I forgot about it, so thank you. So, all right, all in favor of the capital plan as presented and amended?
Aye.
Aye.
Opposed?
Yep.
Carried. All right, thank you, Lawrence. Thank you, Donna.
Thank you, everyone. Appreciate
We're
it.
gonna stick around. We're gonna have a discussion with the health department and their WIC program. It's, we won't discuss it a lot, but you may end up with 3 home health care workers, depending on what happens during this next session. But that will be discussed much further and in much more detail at P&C. All right?
Well, we're prepared. We're prepared. Thank you.
All right. Thank you very much. All right, let's move on as soon as Commissioner Gelman, item 2A is a request to create 1 community health outreach worker, grade 10. Position, a stipulated position that will be contingent on grant funding and shall be automatically abolished upon cancellation of such funding. Legislative request number 182. Do I have a motion?
So moved, Tortel.
Thank you. Go ahead, Commissioner.
Good afternoon, everyone. Thank you, Mr. Chairman. This is very straightforward. It's a grant-funded position for 1 community health outreach.
Yeah, we like these that get abolished when the money goes away. Very easy. So, don't see any questions. Debbie, go ahead. You got your hand raised?
No, I'm sorry. I didn't take it down. My fault.
Oh, no problem. All right, all in favor?
Mr. Chairman,
Go ahead. I didn't see you.
sorry, I'm on the call now. I can't
No,
raise
no
my hand.
problem. Go ahead.
Thank you, Mr. Chairman. A quick question, just in regards to community health outreach worker. I know we have a cultural equity coordinator. What will be the different tasks of the community health outreach worker in comparison to that? Is it completely different? I just want to kind of get a grasp of what the community health outreach worker will be doing, and you know what are kind of like the parameters of what their goal will be.
Yes, thank you very much for that question. So we do have a health equity director, and the health equity director position is drastically different from community health outreach workers. Our community health outreach workers are more boots on the ground. The health equity director is more tasked with ensuring that our policies, ensuring that a lot of our programs contain the health equity component. That position really directs where we go with health equity throughout all policies and just throughout other programs in the county. And community health outreach workers ensure that we have that connection with our different communities, and they're more boots on the ground. A lot of them are program specific, and for separate grants, they really ensure that those grant deliverables are there and that are in place.
Thank you for that correction. And then for this particular person, are we expecting there to be a focus for them, or?
We currently have not set a focus, but we typically conduct community health assessments, and that really directs our focus area. Year to year, we have different focus areas. Once that's determined, we usually post that community health assessment online. It's available on our website.
Thank you, Commissioner.
Thank you.
Not seeing any other questions. All in favor? Aye.
Aye.
Opposed? Carried. 2B is a request to abolish one part-time senior clerk grade 6 position and create one full-time senior clerk grade 6 position. Position is grant funded and will be abolished if the grant ends and funding is no longer received. Legislative request 183. Do I have a motion?
So moved, Tortel.
Lujan, so moved.
Thank you. Go ahead, Commissioner.
Thank you very much, Mr. Chairman. This again is fairly self-explanatory. This is a senior clerk position, and it will be abolished if the grant funding goes away.
I don't see any questions. All in favor? Aye.
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 Opposed? Carried. Item 2C is a request to accept and appropriate year 3 funds for the migrant health services from New York State Department of Health for the period 10/1/21 through 9/30/22 in the amount of $59,000 and not $59,940,000. Legislative request number 184.
So moved, Tortel.
Go ahead, Commissioner.
Thank you very much, Mr. Chairman. The purpose of this grant is to provide access to high-quality, culturally and linguistically appropriate health and social support services, as well as enabling services such as translation, transportation, and other services to reduce barriers to access and to improve the health status of migrant and seasonal farm workers and their families. Typically organizes collaborator meetings to educate, discuss service needs and opportunities. For our migrant health services program, funds part-time seasonal community health workers, typically English and Spanish speaking, who work throughout the county during the growing season, primarily assists farm owners and migrant seasonal farm workers to access care and provides relevant public health education. Historically, we've had approximately over 500, I know annually 526 unduplicated clients that were served in previous grant years. And community health workers provide or arrange health screenings. They assess risk factors and presence of diseases. And those include, but clearly are not limited to, blood pressure, hepatitis, tuberculosis, tobacco use, pregnancy, cholesterol, lead or developmental issues, sexually transmitted infections and HIV, breast cancer, cervical cancer, alcohol, drug abuse, dental health, colorectal cancer, obesity, diabetes, vision, hearing, mental health, domestic violence. And this is just a short list of some of the things that we have come across and have used in the past. And these may be communicable as well as other chronic or other diseases.
Thank you. And I love that word, unduplicated, because a lot of these things is the same people over and over on different days. So that's very good that you have that many unduplicated getting advantage of this program. Go ahead, Mike Paduch.
I believe you're
All right,
muted.
it's strike three, Mike. There you go.
Oh my God, that's it for me, I guess. That 59,940 that we're gonna make our supplemental appropriation for, how long is the state taking to reimburse you for that?
How long is the reimbursement from the time that we apply for reimbursement or just in general? It's typically within a fiscal cycle. So once you apply.
6 months? Oh, okay. Yeah, I just wanted to know because there's some other programs that I'm gonna ask you about as well. And I wanted to see what their status is with the state. So thank you. I think it's an important program, helps all of our local farmers, I'm sure. So thank you for that information.
Take your hand down, please, Mike.
Hey, give me a minute.
Come on. Let's go. All right, I don't see any other questions. All in favor? Aye.
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 Opposed? Carried. Number 2D is a request to accept and appropriate funds from the New York State Department of Health for the PH Core Fellowship Award Grant for the period 9/1/21 through 7/31/23 in the amount of $3,547,330. Legislative request number 185. Do I have a motion?
So moved, Tortel.
Thank you. Go ahead, Commissioner.
Thank you very much, Mr. Chairman. In 2021, New York State established the New York State Public Health Core Fellowship Program that was tasked with building public health capacity to support COVID-19 response operation and increase preparedness for future public health emergencies, hopefully not pandemics, but any type of emergency response within the public health realm. This current funding would fund public health fellows, and there are two different titles. There's a Public Health Fellow 1 and Public Health Fellow 2. The selection goes through the state of New York, and typically the difference between Fellow 1 and Fellow 2 is really dependent on level of educational attainment. It's really undergraduate, graduate degree. That's really the line of demarcation there. They would usually work in the epidemiology, nursing, or community health outreach divisions. And this is funding that was made available statewide, and the funding was based on population size of the counties.
Legislator Tui.
Chairman, can you please add me?
As a sponsor, certainly. Doreen, you got that?
I do.
Yeah.
Lujan, question?
Go ahead, Legislator Lujan.
Thank you, Mr. Chairman. Firstly, I'm really excited to hear about these funds, and obviously it's going to have a great impact for the community. I did have some questions as I was reading through the breakdown. I saw it says 40,000 for telephone. I see just what was it? Trying to see 4,000 for advertising, 20,000 for mileage. Can you talk a little bit about these breakdowns? I'm just kind of trying to make sense of all of it.
So
what falls into specialty payments is just like $1 million in specialty payments, but it seems kind of like very broad. 75,000 for rent. Like, yeah.
So a lot of this is projected funding. This is not specific by any means. This is more projected funding that we have to submit to the state just to justify expenses that may potentially happen. So this is just the proposed projected funding, and it may not look exactly like this once the program is actually set in motion. This is just the projected funding that was submitted to state.
So, okay, that's great to know. So does that mean that we could end up using these funds for other purposes?
So these funds would be used specifically for the purposes of the public health fellowship program that they were intended for. They are not supplanted.
Sorry, I didn't hear that last part.
They're not supplanted. They're not
So
used.
they can be used as long as they're within the parameters.
The guidelines
program.
of the application.
Yes.
Gotcha. And these are kind of the parameters by which we could be using them. We could be using it for advertising. We could be using it for equipment, rent, and so on. This is
yes, within the grant allowable spending. Yes.
Gotcha. Okay, that sounds great.
Thank you. Any other questions? Legislator Sutherland.
Yes, may I be added, please, as well?
Certainly, Doreen, you have that?
Thank you.
Yes.
Okay. Seeing no other questions, I'll call the question. All in favor? Aye.
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 Opposed? Carried. The monthly update, everybody got emailed a copy of it, so we want to have a discussion. If you have some specific questions, you can ask them now or call the commissioner tomorrow. Any questions for her now?
Yes, Mr. Chairman.
Go ahead.
Thank you, Mr. Chairman. Last month and in previous sessions, and definitely last year's budget, we had talked about the concerning numbers in regards to our status in the county or in the state with our numbers in regards to STD numbers amongst our youth. And I definitely had made it a point to say that we definitely don't want to be leading in such things. I think that you had emphasized on multiple occasions that we could definitely be doing better on that. And as I recall, last budget we had talked about a position that would help address those concerns. I don't think I saw that in this budget, and so I'd like to ask you about that and to see if that's something that was decided to be looked at in the future, or if that's still something that you're looking to fill, and if so, do we have a dollar amount for what it would look like?
So thank you very much for that question. Yes, we definitely do not want to lead the charge on sexually transmitted infections in the state. And unfortunately, we did top the charts for specifically two indicators, newly diagnosed HIV infections and newly diagnosed HIV infections concurrent with syphilis infections. With that said, we are hoping that those 15 or so public health fellow positions, at least two of those, will be appropriated to our sexually transmitted infections division. And they will work closely in that division to ensure that we are hopefully decreasing this negative trend.
And so based on those additional funds and how those fellows could be used, you consider that position wouldn't be needed anymore?
The position that you're referring to, the one that we applied for previously?
Yes, that's
yes. So for now, we will have those two fellowship positions, and we are discussing the potential of state providing us with more STI counselors as well. But that's just in the preliminary stages. We're just discussing those. So for the time being, we are hopeful that those two fellowship positions and the proposed 1 to 2 sexually transmitted infection investigators that the state would provide, we will.
You good? Minority Leader Amo.
Thank you, Mr. Chairman. Commissioner, the issue of the rating by the CDC of Orange County for transmission of COVID seems to be stringing along for months. Could you, maybe I missed it, could you tell me a little bit about the metric that they use to generate that, and how valid do you see it? It just seems to always be orange, if you will, on the website. That we're in a really hard situation. Could you explain that a little bit more?
Yes, absolutely. So ironically, yes, we are continuing to see orange, and the CDC continues the designation as being high, and that has been sustained since that has increased, and that designation has been made by the CDC. And we transferred from our substantial level of transmission. We were seeing in weeks past at least over 100 newly diagnosed cases daily. We're seeing somewhat of a downward trend now. Currently, we're seeing a little less newly diagnosed infection. It's too early to say because we just started seeing that pattern. It may be a remnant of just testing and other parameters, but we are seeing a slight decrease in daily test positive cases that we are seeing. However, our wastewater testing that has been implemented weeks ago has been confirming the fact that we are seeing a very high viral burden in our effluent, as it may be. And that really is indicative of broad transmission throughout the county.
And so is that how the CDC is measuring it, both in terms of the effluent?
Not measuring it by wastewater. The CDC is measuring it by newly test positive cases.
As a percentage of the population, or how do they come up with that metric?
As a percentage of individuals tested. The ones that test.
Okay. Okay. Thank you.
Okay, Legislator Tui.
Thank you, Chairman. Commissioner, it was widely reported last week that migrant flights from Texas had flown into Westchester County Airport, and also reported that there were that the migrants were bused to certain areas in New York State, one being Newburgh. I'm wondering what the health department is doing to try to locate those migrants, and what are we doing about trying to get them tested or vaccinated? And I just wanted to know if you have heard anything along those lines.
So we typically deal with anything pertaining to migrant health. We don't receive the actual metrics or statistics or reports of individuals that are actually coming into the county, but when they do come across either our farms or our migrant housing units or anything that's under the purview of the local health department, that's when we are responsible for their health. So as far as vaccination, anytime that we have had vaccination clinics, we have vaccinated migrant workers, we do come in contact with migrant worker housing, and we do monitor for over 60 communicable diseases. So anytime that we have any diseases or test positive labs, that's when typically we would come in contact. We don't get plane manifests or bus kind of manifests for individuals transported, as it may be, but anytime that there is a concern as far as communicable disease potential or any transmission of communicable disease or any prevention efforts on our part, such as congregate migrant housing, that's where we really step in.
Do you think that it would help your efforts if somewhere along the line that the County Department of Health was notified and given a heads up?
Well, notified of
all
individuals travel, because I mean, typically any individual coming into the county from anywhere outside would have the potential of transmitting not just COVID-19, but over 60 communicable diseases. So I don't know how effective that would be to receive every flight manifesto and every single bus kind of route. It may be a bit counterproductive for our effort, which is really to gauge spread of disease and propagation throughout a population.
Okay, I just feel that with us being classified as a high-risk county, that any kind of information that could be provided to us at the higher levels of government would certainly help us try to mitigate that. Thank you, Kim.
Thank you.
Any other questions on the monthly report? All right, so we'll go into the budget review. And Pete, to Legislator Tui, we might want to send as a legislature a letter to the state to try to get those numbers. Because we're not talking 1 or 2 or 3, we're talking possibly significant numbers. So it's not fair to the actual people that they're bringing here that we don't know about them to be able to offer them services. All right, so.
Exactly, Chairman. I'll work on that with you.
Perfect, perfect. So now we'll go into the budget. Do I have a motion on the budget?
Sutherland.
So moved, Tortel.
Thank you. First item on the budget review is education, handicapped child, page 178 to 181. Go ahead, Commissioner.
Thank you very much. You see the budget in front of you. Clearly, the last year and a half of the pandemic response have impacted our operations, and some of that to a certain degree has translated into our budget. As far as services, we have had budgeting, and the federal revenue was based on the prior year's early intervention administration Medicaid claims. And the 2019 claims have had decreases in busing, salary, and fringe from 2018 claims. And as I've mentioned, quite a bit had to do with COVID-19 and the operations or lack thereof during the response.
Any questions on this section of the budget?
Yes, Mr. Chairman, I have my hand raised.
Sorry, I didn't see you. Go ahead.
Thank you. Could you just explain, I don't know if it's your budget, don't have to explain this, but on page 180, the 2021 year-to-date as of 6/30 is a negative 328,172. Second line, state aid.
Commissioner, do you want me to do that?
Go ahead.
Okay, so what happens in the beginning of the year, especially last year, because the state was holding back some money, we put in an accrual. And so we accrue the money, and then in the beginning of this year, we reverse it. So again, the state is taking a little bit longer to pay the bills, so the money hasn't caught up yet. So that's why it's a negative.
Thank you, Mr. Chairman.
All right, all in favor of the education handicapped child budget as presented? Aye.
Aye.
Thank you. Go to the early intervention, page 182, Commissioner.
So I will take any questions because the budget is pretty much very straightforward. As I mentioned, there were some changes with bus transportation and services in general, but overall, we've answered any questions in writing that presented previously.
Minority Leader Paduk.
Thank you, Mr. Chairman. In this regard, and I think it's with education of handicapped children as well, is the state reimbursement rate still 59.5%?
Yes.
It is. And how much money is outstanding that we haven't submitted for, or are we up to date? And the reason I ask that is because when I first became a legislator, this county lost $20 million by not submitting for reimbursement. So I've been on that case ever since then, and I'll ask it every single year. How close are we, and what's the outstanding amount of reimbursement that we're due, and have we submitted for it? Because there's only 3 years, right? After 3 years, too bad.
Right. We're up to date on our submissions right now.
Great. Great, thank you. That's an important question for me. Thank you so much.
Leader Amo.
Yeah, Commissioner, just a quick question on the early intervention numbers. They really seemed at least to be static, and I'm kind of wondering, is that, in my history, I remember it really always growing. Why is it static, and what's your feeling on the future?
Yes, so you're absolutely correct. It does reflect a decrease in utilization just sheerly due to the pandemic. And we're seeing a remnant of that carry over, but projected, we anticipate seeing the same trends continue that we saw years prior to the pandemic.
Yeah.
So it will continue to increase.
And yet we're projecting a 22 budget down 9%.
It's because of the prior, essentially over a year and a half of the service decrease.
So even though you think it might grow, we're going to have enough money to take care of it, you think?
Yes.
Okay, thank you.
Any other questions on the early intervention budget? I don't see any.
Mr.
All in
Chair,
favor? Go
Jimmy?
ahead, sorry.
And that's all right. I saw Lee Benton's hand is raised. I don't know if he has a question.
All right, I don't see. Go ahead, Legislator Benton. I see him muted on my screen, so.
All right.
All right, we can come back to him, but. All right, as presented, all in favor?
Aye.
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 Opposed? Carried. All right, we'll go to the medical examiner, page 189. Go ahead, Commissioner.
Thank you very much, Mr. Chairman. So most of the increases that we are seeing, again, are related to pandemic response and sourcing, supply scarcity, and the pricing increase that went along with that. Throughout the duration of last year, majority of the PPE that was provided, as well as supplies that were provided specifically to the medical examiner's office, were through emergency services. This year, it's our spending, so that's reflected in the budget. And the principal account clerk position was just moved as far as lines from the medical examiner's budget to the public health general budget.
Legislator Tortel.
Thank you, Mr. Chairman. I apologize if I missed it because the sound cut out for a few minutes over here. On page 192, about 3/4 way down, 561530, Chief Medical Investigator. This seems to be a new position for $74,386. Can you speak to that, Commissioner? Thank you.
Yes, thank you very much. So this is a new position, and typically these would be contractual services. And what we are seeing in lieu of continuity of operations, a lot of our unattended deaths are discovered during regular business hours, typically Monday through Friday within that window of anywhere 7 to 5 o'clock. So this position would take care of a lot of those calls and ensure that there is sufficient staffing, because the issue with contractual services outside of the spending alone also is the operational component and logistics involved in scheduling multiple individuals and ensuring that there is an individual available to respond to an unattended death. So that's what you are seeing reflected in that position. That would be a position that would make those services available and steady.
So I see on the page below that, page 193, that there's an adjustment to your line 571820, consultant services non-medical of $40,120. Is there the rest of that 74,386 somewhere off of your contractual that I'm missing?
No, so the adjustment that was made for $40,000, and some of, is that salary and fringe? That's the salary line. Yeah, the consulting line was decreased by $40,000. Because there's still.
Okay,
will
because
be
this position,
Right, but there would still be consulting services for weekends and holidays and all other hours as well. Because after hours, in order to respond to scene, you would still have some contractual services. That's the.
right, but this position at 74,386 with benefits will be closer to 100,000. So I'm just trying to figure out. So I'm just trying to figure it out because this department went up by 156,149, and the bulk of that then is that new position.
Right. And well, a lot of it is that new position, but you're absolutely correct. The position will take care of the regular operations Monday through Friday for that 8-hour day. But for the rest of it, we will still have some contractual services because you still have death happen in the after hours. So it's more
Okay.
continuity of operations and not necessarily an exact dollar amount that will translate and negate from the contractual services.
Okay, has this position, is it replacing other than contractual, any other positions? And then also, have you brought this to the Personnel and Compensation Committee in any shape or form? Because I'm not recalling it.
So no, this will not have any other component, only the contractual services and personnel.
Not in P&C yet.
It has not gone in front of P&C just as yet.
Thank you, Mr. Chairman. Thank you, Commissioner.
Okay.
Thank you.
Minority Leader Paduk?
Yes, thank you, Mr. Chairman. In regard to that position, has the county executive approved it?
Yes.
He has. Okay, and this is odd for me, but I want to compliment you in regards to your contractual expenditures. I've talked about this almost in every department. You are almost on target, and they are all, most of it is county taxation, right?
Yes.
All right, so some departments are off by close to millions. Some are off by 800,000. You're within 75,000 over the last 4 years of all your requests. So that's a big compliment from me because I think you're doing a fine job, and I hope that you keep it up.
Thank you.
I don't see any other questions.
Mr. Chairman,
Go ahead.
Dr. Roman is on here, and so is Lee Benton again with his hand raised.
Legislator Benton?
No, I'm sorry. I don't have my hand raised.
Okay.
And I have Dr. Roman with her hand raised.
Go ahead.
Hi. In addition to what Dr. Gelman said for the in-house investigator position, in addition to offsetting the contracted costs, it's also very important that we have an in-house investigator to assist with death investigations and interactions with families and follow up on cases that the contracted investigators started but cannot finish because they've gone on to their day jobs or night jobs, so to speak. So all of our neighboring counties of Dutchess and Rockland all have in-house investigators, and we're serving a larger population. And the investigative work is now being handled by the doctors, and there's a lot of cross coverage that other staff is doing to fill the void left by the absence of an in-house investigator. And the downhill effect of this is it's increasing our turnaround time, which means families and loved ones are waiting for longer for reports. They're waiting for longer for our answers. And it can affect payouts of life insurance, of benefits. It can affect criminal investigations. So an in-house investigator would allow the investigative work to be done by an investigator and allow the doctors to focus on what our office's main export is, which is the finalized autopsy reports and getting families their answers.
Thank you. Legislator Totel?
Thank you, Mr. Chairman. I was also reviewing under this department. I don't see anything in the capital plan in regards to the new morgue and medical examiner's office. Can you explain
Oh.
why we're not seeing anything for that?
We'll get to that at the capital plan. Don't worry, that's not going to be a very nice discussion.
Yeah, well, I just thought we were going department by department. I didn't see anything capital plan under medical examiner.
No, it's there. It's there. Big
It's
figure
under
too.
help.
Michael Jordan, 23 mil. Yeah, so. Right. So I'll call a question on the budget as presented for the medical examiner. All in favor? Aye.
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 Opposed? Carried. Next is public health, page 192. Or 197, sorry. Go ahead, Commissioner.
Thank you very much, Mr. Chairman. So for public health, as I mentioned, we did move that one principal account clerk position from the medical examiner's office budget to this budget. So you will see that reflect.
Any questions on the public health section of the budget? Go ahead, Legislator Paduk. Minority Leader, go ahead, you're muted.
Just, I didn't talk before that, Jim, not fair.
I got it.
Anyway, this
three and a half.
this
Just
is
a half.
another section of your, 3.5, good enough. This is another section of your budget under your contractuals. You are so close. I'm just gonna keep complimenting you because all these other departments need to get on board with what you're doing. If you are looking for county taxation for contractual expenses that we're charging them tax on, you should be within all the ranges that you have in all your different applications. So I'm just gonna keep complimenting you because that's what it needs. Everybody needs to hear that.
Thank
So
you.
thank you.
All right. Wait till you get to the morgue, okay? Any other questions on the public health? Seeing none, I'll call the public health section of the budget. All in favor? Aye.
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 Opposed? Carried. Rabies control, page 209. Go ahead, Commissioner.
Thank you very much, Mr. Chairman. So for rabies control, we have seen somewhat of an increase in cases. Not sure if that, again, has to do with resulting from the pandemic and just the increase in individuals presenting outside. But we have seen a slight increase in cases. Typically, we're in that mid-80s range annually, and we've seen upwards of 90 cases, actually closer to 100. So that's somewhat reflected in the post-exposure prophylaxis specifically.
Okay. Any questions on this section of the budget?
Just a comment, Mr. Chairman.
Okay.
This is probably her best contractual expenses savings. It's within $5,000. So everybody listen to that. Look at that sheet and then compare who's doing the best job for our county. And we could all be doing it if we would address the overestimated expenses. So thank you for that, Commissioner.
Thank you.
Thank you. Seeing no other questions, I'll call the rabies control section of the budget. All in favor? Aye.
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 Opposed? Carried. The final section is WIC, page 213. Go ahead, Commissioner.
Thank you very much, Mr. Chairman. So for the WIC program, as of September, the program, the New York State grant contract was completed on September 30th. And those services are now provided by federally qualified health centers throughout Orange County. So that program is no longer with the local public health department.
Legislator Tortel?
Thank you. Will it still be monitored via the county, or is it all a contract now between the state and the public health centers?
No, so you're absolutely correct. It's a New York State contract with the federally qualified and other health centers to administer that program throughout the county.
Okay, thank you. Thank you, Mr. Chairman.
Thank you.
Thank you. Minority Leader Paducah.
Yes, sir, Mr. Chairman, thank you. I do have a question on this contractual expenditures, though. Over the last 4 years, it seems like you've almost averaged $300,000. Is this all state funding? No, right? This is county taxation? And if that's the case, well, I'm sorry, go ahead.
No, so this program is entirely 100% grant funded.
Okay, thank you. So what's the reason that we're not spending $300,000 on this most important program?
Well,
Or you're not getting it?
Well, we did not have the staff to continue to provide the services, and New York State is the one, it's the entity that awards the grant, and it awarded the grant to federally qualified health centers within the county to continue to provide services.
Okay, so, I mean, I'm just not quite sure why, if we have contractual expenditures in our budget and it averages 300,000 not being spent, can we do a better job? I mean, how would we be able to spend them to provide more services?
Well, we no longer hold that grant contract entirely. The state chose to award that contract to another entity.
Oh, they're doing, okay, directly.
Yes.
Okay, thank you. Thank you, Commissioner. That's all I have.
Okay. Any other questions on the WIC budget as presented?
Mr. Chairman, Michael Amo, I would imagine
Go
that
ahead.
with the statement on WIC, the commissioner must be pretty happy that they moved it to another agency.
Well, it's really not about happiness. I am fairly glad that the services will continue to be provided to our residents, and the federally qualified health centers that were awarded the contract were already providing the said services. So this is really a continuation and expansion for them. Plus, just the fact that a lot of the residents tend to present to the federally qualified health centers for other services. It's just a seamless service provision entirely. So it is great in terms of just improving the service provision. For residents.
Okay.
Yeah,
Thank you.
it makes perfect sense. I just think, but I remember historically all the bumpy road that WIC program has had for us. That's what I was sort of remembering. Okay, thanks.
Thank you.
Minority Leader Paducah.
Chairman, I didn't have my hand down. No question. Take my hand down. I'm trying to.
Thank you. All right, seeing no other questions, I'll call the WIC budget as presented. All in favor? Aye.
Aye.
Opposed? All right. Thank you, Commissioner. And as stated earlier during the Valley View presentation, so there's, as best as I understand it from talking to Commissioner Human Resources, Steve Gross, there's 3 WIC employees, and 1 or 2 might have put in for retirement. And then the home health aides, they are possibly going over to Valley View, but like I said, that'll be discussed further in P&C. And we're going to find positions for those people. Okay, so everybody is aware of that. So stay tuned for the next P&C.
Mr. Chairman?
Go ahead.
You have to do the capital plan for the medical examiner.
I was saving that good news. Okay, so now we'll get to the capital plan for the health department. And they have one project, and that is the medical examiner's building, $23 million. So I've been involved in this pretty much from the start, even when we went from the coroner system to the medical examiner system and studied how much that was going to cost us. Went over to Dutchess County and some other places. And originally, this was $5 million. Then it went to $11 million. and now it's in front of us for $23 million. So I've had conversations with Deputy Commissioner Erickson. You know, obviously the cost of construction has gone through the roof, and it'll be less, but, you know, what's gonna be less is this is for an 18,000 square foot building. So I think at this point, we have to go back to the drawing board and look at a much more reasonable size building at a much more reasonable size price, but I'll open it up for other discussion. Minority Leader Paduk.
What page is this on?
Thanks, Mr.
This
Thanks, Mr.
is
Chairman.
on,
Page 8.
Page 8.
of the
Has there-
capital plan.
Right. Can you tell me how much money's been expended so far in regards to design maybe and stuff like that? And where is that in the budget?
So I don't have that exact figure in front of me right now, but I can most certainly provide that to you.
Okay, so you don't know how much money, I mean, I don't remember, I remember discussing it, but I don't remember approving money for design and stuff like that. I don't know,
The
Jimmy, maybe you
survey.
remember that?
Yes, it's
We
been,
approved it.
yeah, but we can definitely give you those figures.
Thank
We can
you,
provide
thank you,
figures.
that's all I need.
Leader Amo.
Yeah, Mr. Chairman, I hear your discussion. I don't your introduction to this, and I don't disagree because I don't have all the information, but it seems that what made the $18 million sound okay, or 5 million, and other than it's a lot of money. And I kind of think in terms of a county that's growing and the need to have full service morgue services and medical examiner services is important. And I know it's too expensive, but I'm trying to balance it in terms of how much too expensive. And why do you think it is? You raised the point and I wouldn't have thought about it. I'm wondering if you could enlighten us.
Well, first thing we have to look at is the square footage, because all construction is based on X number of dollars per square foot. And it's gonna be a unique building, all right? But we gotta look at first thing, cutting down, do we need 18,000 square feet? So, Legislator Sassy,
Thank you, Mr. Chairman. Yeah, I just had a question on that $23 million price tag. I know the bids had gone out, and I'm just wondering if those bids were, I don't know how many, I think there were 3 or 4 companies that had bid on them, but how could anybody bid on something and then have this skyrocket at 23 million? So I hope moving forward, we look at this very, very carefully as the price, and we all know that the price of goods and services has skyrocketed as well, but this just seems a little out of the ordinary. So I hope we'll proceed with caution on it. That's all. Thank you.
Lujan?
Legislator Tui.
Thank you, Chairman. With the progression of the expenditure going up, as you mentioned previously, can we pinpoint anything more solid where I know that the costs have all gone up, but it's exponential? And is there any outline where we could see where exactly on each items what different components of the construction have really gone off the charts?
Well, I don't think that's our expertise. We'll have to get somebody in the construction field to help us. Barry's certainly our expert in the legislature on that, but that's a discussion we're gonna have to have moving forward, because I don't think anybody's in favor of 18,000 square feet, $23 million building, all right? So Legislator Cheney?
Thank you, Chairman. Yeah, there are a number of factors that have gone into it. We certainly deserve to get further information on this. In part, it's the increase in the size, and as was stated by others, the increase in the cost of materials that we've seen occur over probably the last 18 months. To date, all these efforts have been directed by the architect who was hired by the county to provide the design of the building. The county has gone out and procured the services of a construction manager. The construction manager is expected to be much better than the architect in terms of preparing cost estimates for construction. So I'm hopeful that once the construction manager gets on board, he or she will be able to provide us with more accurate numbers. And also their job is to take a look at value engineering to determine if there are better ways to construct the building and better ways to possibly modify the design that would result in cost savings. So there's a lot it's early on. I think that the $23 million that's been proposed is kind of a way up at the top type estimate. And hopeful that over the course of the next 2 or 3 or 4 months, we'll be seeing more accurate information relative to this. And relative to the question, I believe what we've approved as a legislature initially was $1 million for the architect, and then there was a second $2 million appropriation that we made for the construction manager and other aspects of the design through procurement of a contractor activities. If anybody has any questions, I'd be happy to try and give further information, but I think that's about it.
Okay, thank you.
Mr. O'Donnell, this is Chris, if I may.
Just in a second, Chris, all right? Legislator Amo, you still got your hand up, you're good?
I'll take it down, thanks, sorry.
All right, go ahead, Chris.
Yep, just to reiterate, this process has been very thorough so far, starting with the needs assessment, which the legislature all saw, and going with an architectural firm, and that architectural firm getting the support of another architectural firm, Crime Lab Design. So, the meetings on this have gone very well as far as really fleshing out what the needs are for the county, the future of the county, getting something that is respectful for the citizens of this county. Definitely that price tag, and we all know that price tag is really high. And as Legislator Cheney said, that is a early estimate as far as what we have here. And unfortunately, when that estimate was given, we were right in the midst of the building crunch with prices and stuff. So, I think that number is going to get more realistic as we get down to it. But you also have to remember, we are not building a county building. This is a specialized building. The price of materials for that type of building, we think of building basically, something equal to or better than a hospital as far as the types of equipment that you have in it. It's very specific with the types of things that you have there. So it's hard to compare the same type of construction costs you have with any other type of government building that you have in a medical facility. This is going to be a state-of-the-art medical facility that your
okay, Chris. We support it. We're just not paying $23 million. So we don't have to debate this all day long. All right, I'm going to move to Legislator Kulisek.
Thank you, Mr. Chairman.
Jim, are you there?
That was going to be one of my questions, was the fit out of the building for autopsy and things like that. I had put together a building for animal research and necropsy. It's almost the same thing. They do the same thing on animals that they do on people, post-mortem. And the rooms were absolutely just stacked with specialized equipment. And I was curious if this price tag included all that equipment.
I'm sure it did. So that's how you end up with $23 million. All right. But obviously it needs a lot more discussion. So I'm gonna tell the health department and the medical examiner to come into us with a lot more details. And one of the problems in any public works that go out, we put a figure on it, and that's what comes in, all right? You know, we have to put a number out there first. That's one of the downsides of being in the public domain, is we say, all right, we're gonna allocate $10 million for this. And then all the bids come in at between 10 and 12 million. Nothing comes in at 6 million if we're already told the public we're spending 10 million. So that's my big concern with us putting out a price tag at 23 million. All right. So I'm going to ask budget. So what do we do with this as far as changing the number? Deb?
You can make a motion to reduce the number, and then I will make the change in the capital plan when it's fine.
All right, I'm all ears.
Did you hear me? Hello?
I did. Yeah,
Oh,
I did. I'm just all ears to the legislators here to
Okay.
see if they want to keep with 23 million and put it out there, or lower the number and then get some more information from the medical group.
Chairman, I I wouldn't know where to venture to guess to how much to bring it down. I know we all agree that 23 is a lot, but I mean, how do we make that educated guess, you know?
Well, it's going to be an educated guess. So Legislator Sassy? You're muted, Rob.
That's one.
Hasn't the bid already been awarded?
No.
No.
No. Okay.
No,
I
and
thought it
with
was.
the price of construction, my guess is it's gonna be rebid, because if we have questions about the size, 18,000 square feet, and we can get a couple of thousand square feet taken out of the building, who knows, all right? So anyway, I'll make the motion to knock the 23 million down to 17 million, all right?
Excuse me? May I speak?
Dr. Roman?
Yes.
I
I'm
see,
sorry.
Dr. Roman. All right, this is basically, all we're talking about is construction. We're not talking about your need. We're all in agreement of the need for the building, all right? Now we're basically talking construction prices, so. Anyway, I made a motion to lower it to 17 million.
I'll second that motion, Chairman. Tui.
Okay, discussion. Legislator Amo? I see you, Lori.
Yeah, sure thing. I mean, I kind of go along with Legislator Tui when we talked about an educated guess, and I'm sure you had some idea, Chairman, where you came up with it. I think we're making a mistake. I wish there was another way to do it, because I don't think we really know what quality we're getting for this amount of money to just immediately drop it at this point. So I'd have to be a no vote on that.
That's fine. Hey, I'm dropping it based on, I don't think we need 18,000 square feet. 14,000 might be good enough. And the cost of construction is going to come down. I'm just basing it also on, when we put these numbers out, that's the numbers we get back from people bidding on it. Legislator Tortel.
Thank you, Mr. Chairman. My question is, I'm concerned about the elevated costs with you. I don't dispute the need. However, my question would be is, if we move this into an austerity situation, would we lower the amount of taxation that we have out there? So this is probably more of a budgetary question on that. I'm just trying to figure out, all right, you were reducing it by what, 6 million. And I was wondering, I don't know that we're going to actually have this project shovel in the ground within the 2022 budget season. So if we had the money and we put it into an austerity, how does that affect county taxation? And also, how does that affect the project if it is ready for a shovel in the ground in the 2022 year? Thank you.
Well, I don't think it affects anything till we approve it out of the capital as far as taxation
Right.
goes. So, Legislator Cheney.
Thank you, Chairman. I'd just like to point out that we're still pretty early in the process. When we embarked on this, when the county did, numbers were very general. Size was very general. It was based on a preliminary needs assessment. I think at this time it's inappropriate to make this kind of a change because there's much more work to do. As that work is conducted, we will be apprised of changes and we'll have the opportunity to understand the basis for the costs as we move forward. And in the end, they have to come to us to get authorization for the money to spend for the construction of this facility. So that number is something that we're going to have another bite of the apple at. So I just would caution us, making any significant changes now. Thank you.
Leader Paduk.
Yeah, actually, I agree with both of you. And the fact is, in construction like that, if you want to lower the price now so that number's out there, I get it. And maybe it works. It's worked in some areas that I was in construction for 40 years. It's worked in some areas. I will mention a couple other things, though. We have built buildings, and I'll give you an example. At the Board of Elections, we approved money for that, and we didn't build it big enough now. Now they're overcrowded. So, I'd like to hear all the information as well, like Mr. Cheney said. But I think letting them know that we're not willing to spend that kind of money, and maybe we can get it. That's happened in the past. You lower the number, you'll get all the same stuff for a lower number. So I agree with you in that aspect. And although I'm not a committee member, I would vote with Mr. O'Donnell to lower it for now. And keep in mind, we're just approving the capital plan. They have to come back to us to get any of that money and explain all of it again anyway. So that's my opinion.
I agree. All right, Doreen, we're going to do roll call on
Mr. Chairman?
the amendment. I'm doing roll call on the amendment to lower it to 17 million. Go ahead, Doreen.
Mr. Chairman?
Okay,
We're doing
Amo?
roll call now. Right, so we all agree we need a building. It's just a matter of what money we're going to put out there to the public. So the roll call is yes, we'll reduce it to 17 million.
Amo?
No.
Anagnostakis?
Yes.
Luhan?
Aye.
Hello?
Hello?
That's a yes.
He was a yes?
Yes.
Yes.
Okay. Sutherland?
No.
Tortel?
Yes.
Tui?
Yes.
O'Donnell?
Yes.
Motion passes 5 ayes, 2 noes.
All right, so I'll make a motion to accept the capital plan as amended. All in favor?
So moved.
Aye.
Second. Aye.
All in
Aye.
favor? Aye.
No, I
Aye.
oppose.
All in favor except for Leader Amo. You got that?
I said no,
Doreen?
I'm sorry.
All right, so do a roll call, so it'll end up the same as what we just did, so. Go ahead.
Okay. Amo?
No.
Anagnostakis?
Yes.
Luhan?
Aye.
Sutherland?
No.
Tortel?
Yes.
Tui?
Yes.
O'Donnell?
Yes,
5 ayes, 2 noes.
thank you. Thank you, so, Commissioner, Doctor, you got some work to do, get us some numbers. We're here, we support it, but we're not putting that number out to the public, so.
Will do. Thank you very much,
Thank
Mr.
you.
Chairman.
Thank you very much. Appreciate it. Commissioner Miller, thanks for your patience.
It's been a pleasure, Chairman O'Donnell. Good afternoon.
How are you?
Very good, thank you.
Okay, so everybody got the monthly update? Any questions on her monthly update? I don't see any.
I think
Rita
Michael
Amo, is that you? All right, we'll go to item 3B, 2022 budget review. Need a motion?
So moved.
Thank you. First part will be the contracted mental health, page 218. Go ahead, Commissioner.
The contracted mental health, usually stuff the other way, but that's good. Our contracted mental health came in under the 2021 budget amount. We came in at 19,346, 344 submitted budget for 2021. 2022 is 19,083. Am I echoing? Yeah.
You're good.
You can hear me? Okay. So the reduction, the decrease in the amount that we budgeted for 2022 was mostly connected to reduction in state aid. Unfortunately, we had a loss of state funding for the Honor Oasis Addiction Crisis Center, a reduction of $399,900. We also saw a reduction in state funding for OPWDD access workshops, which was part of a plan, an OPSED plan to move people with IDDD challenges into community rehabilitation rather than into workshops where they are segregated from community. So that reduction was $675,707. And we additionally had a reduction in other revenue, and that is connected to the Mental Health Association call center. Oh no, that was, I'm sorry, and other revenue. That was for DSS, the money into our 311 call center to support answering calls around the emergency mental assistance program. And we had a increase in our federal dollars, and that had to do with HUD beds that we transferred from for REPAP and MHA. We transferred that from our side of operation administration to those. So those are the changes for our contractual services and health.
Thank you. Legislator Amo.
I have no comment. I just didn't put the hand down. Sorry, thank you.
Okay, no problem. Any questions? Legislator Paduk, Minority Leader. You're muted. You're muted.
No, I'm not. In regard to your contractual expenditures, I'm not sure on the 4320, the mental health programs, that fund, every year, it's an average of $3 million close to that's not spent. Is that mostly grant money that's not used, or is that county taxation?
I'm sorry, you're on, you moved to administration. Could you give me a page number, Legislator Paduk, please?
I'm sorry, I can't give you a page number. I'm looking at the trend charts that all the legislators received in regards to monies that were included in your modified budget and then the actual spent that year. So when I come up with these numbers, the average of almost close to $3 million in the contractual expenses on the 4320 mental health programs fund. Why is that? I mean, I don't know. Is it all county taxation? Is it state grants included or federal grants in there? Do you know that figure? Or maybe Deb could help me out or help you out.
That has to do with their fees. So So let me just say that, you know, when you're looking at our budget, you have to look at our expenses and our revenues. And remember that other revenue for our department is, give you the total amount of the other revenue. So our other revenue is $6 million. So, you know, that has to do with fees that we draw in from our clinical services. When we budget expenses and fees. So we had an anticipation that we were going to have an increase in our school satellite clinics. So we budgeted the expense and the amount of fees we collect connected to those. We also have had some of those contractual positions have not been filled. So every position that's filled has an expense, but it also has a revenue connected to it. So if we don't have the expense, we don't have the revenue, it's just a loss. And it's not taxation.
I get it. And actually, you were going in and out, so I didn't get all of it. But in regard to the return, we're not spending $3 million in the average over the last 4 years. Why? I mean, I'm not understanding that.
Well, there's some of the clinics did not open, so some of these satellite schools did not open. We had this discussion in our committees in the past. They're working out MOU agreements. And in order for the state to move through one to move on to the next one. And additionally, when we are not able to hire, so we're struggling right now with hiring clinical social workers and licensed mental health, licensed master social workers to fill these positions. So we have some vacancies in our satellite consultant services. We additionally have vacancies in our prescribing. So these are also consultants that we hire in our clinics. And so we've had less expense connected with those services and then no revenue connected with that expense either. But I'm not looking at the same sheet you're looking at. So I'm going with what you're saying and connecting it. So I know Deb is there and she has the sheet. So please, Deb, if you have anything to add to this discussion.
So no, you're absolutely correct, Darcy. If they don't spend it, they don't get their other revenue and or state or federal funding that goes along with it.
Okay, so that goes with it, but is it county taxation?
No, a lot of their revenue is other revenue, which comes in from insurances and those types of things, and state and federal.
And there is county taxation. What percentage would you say is county taxation?
Probably, let me just click here. So in the contracted mental health programs, it's 2.4 million out of 19 million in 2022.
Okay, we don't know what portion was not spent because we don't break it down that way, right?
We don't, it comes in as a lump sum.
Okay, I'm looking to, as I said before, in all departments, can do a better job in their contractual expenses line and by reducing costs to the taxpayers. That's our job, being fiscally responsible. We all can do it. If we were at zero-based budgeting, this wouldn't be happening. Anyway, thank you for the information, and I'm just going to keep talking about it. So,
thank you.
Yes. Yeah, I don't think it's contractions.
Any other questions on the contracted mental health piece of the budget?
Yeah.
Seeing none, all in favor? Aye.
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 Opposed? Carried. All right, the mental health section, Commissioner,
Yes.
page 222.
So we come in on this, on our administration side. We also have a reduction on this side of our budget. So we came in at a 14.5 approximately in 2021. We're at 13.5 in 2022 submitted budget. That has to do with the closing of our jail clinic. So we're no longer operating the jail clinic, and they've successfully contracted the sheriff's office with WellPath to provide that service. So we have a reduction of 700,000 approximately there. Our state aid reduced by 200,000. That's our Well-Informed Geriatric Initiative grant-funded program, which Lacey led the charge for us to apply for that, to have it awarded in 2022, which we will have 300,000 for the next 5 years. Each year, beginning in 2022, we'll come in front of you early next year to have that added to our budget at that time. The other revenue is part of a decrease, is part of the discussion we were just having moments ago that really has to do with fee collections, and it has to do with not having the expense or the position filled to collect to bill for that service. So we just have an overall reduction in our anticipation of fee revenue. And that's it in a nutshell.
Any questions on this section of the budget? Legislator Minority Leader Paduk.
Yeah, just the sort of same kind of comments. I will mention though, in 17, we were close to being exactly what our contractual expenses were. And yet 18, 19, and 20 went back to $3 million. I mean, I'm hoping that on the county's portion, we need to do a much better job. And sorry if I don't seem like I'm picking on you. I've done this to everybody. So I just wanted to mention it. I think we can do a better job in all our contractual expenditures. And I'm hoping that we do that in the future. Thank you.
Thank you.
Thank you. Any other questions or comments on the budget as presented? Seeing none, all in favor? Aye.
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 Opposed? Carried. The desk is clear. Motion to adjourn.
So moved, Hotel.
Thank you. Thank you all for your cooperation. Have a great evening. Thank you.
Have a great evening,
See
everyone.
ya.
Stay safe out there.
Nice.
Thank you.